we're going to do now is get to kind of you've heard everything that we had to say, and what we'd like to do now is turn it over to Dave Weed, Mike Coughlin. And what we'll do is we'll get into groups. We'll hopefully have somebody at each table who's willing to take notes and be a recorder and then report out after a half hour or so. I can see Dana looking at someone and he's saying, you'll be the recorder because I'm not doing it. And then we'll talk about some of the things that might be the challenges of becoming a safe, dementia-friendly Fall River. So we'll have some time to do that. But Dave and Mike are now in charge.
Thank you, Nancy, and thank you all for being here. I think you can see that this is the beginning of a long process that we're going to engage in the community over a number of years, but every effort has to begin with the first step, and this is really that opportunity. Partners for Healthier Communities have been working on making health improvements in the community for the last 25 years, and I want to introduce Mike Coughlin. Some of you may remember he was the Health and Human Services Director for the city. Most recently, he's been working for the Department of Public Health, and both of us have retired in order to work with you on a number of issues regarding health. So Mike's going to engage you in the discussion process, and I'm going to continue the process of recording this so that we can share what's gone on today with the rest of the community.
We want to engage you. We have shared with you information from Nancy and Secretary Bonner about what a dementia-friendly community might look like. And we heard from Paulette and the caregivers about some specifics about dementia. So now our task is to take that information, merge it together, and overlay it onto our own community. You are all the ones who know what Fall River is like, know the community, and can begin to help us in this first conversation about what changes we would need to make here to make it more dementia friendly. We've identified a few questions that we want to address in the small groups. There are only 3. We'll put them up sequentially, but I'll give you a preview of them first. What are Fall River's strengths and gaps for being dementia friendly? What are we already doing well? What do we need to do a little better? What areas are the highest priority? So you'll make a list of the strengths and the weaknesses, then pick a few of them as priorities for further action. And who else do we need to engage? The third question, who else do we need to engage in that conversation? Bring them in, folks who weren't here this morning. That's it. As you're leaving, hopefully you can stay with us until 11. If you have to leave sooner or on your way out, don't forget to fill out the card. If you have any interest in being part of this going forward, leave your contact information. We want to count you all in. Begin to talk about the strengths and the gaps, what we need to do here in Fall River to become more dementia friendly.
We'll keep some notes. We'll be all right with notes.
I don't mind doing notes.
We're both from the department.
I do. I meet with a lot of families, so I'm aware of the resources that are available in the community, but the information's not getting out to the people who need it.
He takes her someplace twice a week, but I don't know where that is. It could be Bristol Elder, it could be people poor. I have no idea where it is. But it's basically adult care, I guess, for choice of better words.
Yeah, and there are different...
A few of those around.
Yep. And some are more dementia-friendly than others.
Dementia, it's really a family. Right.
To a bank, to a restaurant, to a hotel, and to have individuals working in those institutions and our organizations who are compassionate, understanding, knowledgeable, and don't dismiss this individual because their brain doesn't work as well as it used to.
So I was involved in a program for, it's called Face Stroke, to identify children with strokes. So I was part of that commercial, not making it, but I was part of how are we going to reach out to the children. And the children are with grandparents, with babies,
more vulnerable to
She insists on having every night she'll have it. And then there are other days where I was down there over Columbus Day weekend, and I drove back on Saturday afternoon. Spoke to her Sunday. She says to me, so how did you drive back yesterday?
yeah, it gives a family a sense of security. That we're not. I mean, we're worried if they don't. If they do, at least we know it's going to be an immediate reaction when we get them. You know, it really becomes very important.
More financial resources for the caregiver. Well, there's always an important part of having them have the caregiver, have that person come out to that house and take care. And like you said, you couldn't come in the morning, but only could come in the afternoon. That's always been a problem with that.
I've done it myself, and I have to say it's tough. You want the help, you want the extra resources, but it's just, it's not always possible.
Right.
Like, it's exhausting, and it's
Well, I know my father-in-law had it, and yes, he was saying that, you know, that's one thing, he never lost his true sense of identifying, you know, my husband coming in or me coming in. Maybe got our names wrong, but knew who we were. It was that we were family, you know.
You were lucky.
So, yes. Oh, most definitely, yes, most definitely.
That are not specifically Bristol or whatever, but I mean, you do it all the time, David, what you do for the community and things like that. I agree that is a big strength.
Okay, everybody, so you've had some time to talk about the strengths and the gaps. You should be moving on now to the second question, and I'm going to put the second question up. What should our priority areas for action be?
Between caregivers and emergency personnel.
And include emergency medical services in notification.
Because ultimately that's what you're going to call.
Yeah,
right.
Mother would get off her car and go to the room next door. But everybody on the garage.
They didn't make a big deal out of it.
I think there was somebody that we could get in touch with and say, what should I do in your store? I'm going to come here, not to eat, and keep cards wonderful, but it's another nail in the coffin.
Is that one, everybody good on that one?
Pretty nice to meet.
Our biggest challenge is that everyone in the family is on the same page, so we don't know what the conversations are, and we have
Conversation about gaps and strengths and priorities. Think about who should be with us who's not here today. Much of the great conversations that I know you were having is possible. So I'm going to go table to table with this mic that's working a little bit, and ask one person from each table to give a quick summary of your discussion. And we're going to have a couple of people up at the flip charts here in the corner capturing what you report out.
Okay, we were actually talking about the strengths, and one of the things that we were talking about was some programs that we currently have that exist here in the county where we actually provide bracelets for people who are, it's called Project Lifesaver. We provide bracelets for anyone who's suffering from Alzheimer's, dementia, or autism. And basically what happens is we provide that bracelet. It has a signal that's sent out, and we have police departments around our county who we've equipped with this Project Lifesaver equipment. So if someone wanders from the home, you don't know what direction they went in. Normally, in those cases, we'd have to call. You call the police, they come, and basically you now have to wait for teams to come in, try to guess where this person might have wandered. In this instance, the police departments are equipped so that we can all respond. We'll have usually 3 departments responding with a receiver and an antenna, each one. And as we're triangulating into the location where the person left, we can start picking up that signal. We generally find them within 30 minutes. Now, that becomes critically important because, as you can imagine, if someone walks out in the middle of the night in the nightgown in some freezing weather, time becomes a real factor. Also, because of predators or people out there, it's important that we get to them as quickly as we possibly can. We also have another program called Iris Scan, where we could actually have the individual registered in this program, where we actually put what looks like binoculars up to you. They look into them, and within about 2 seconds, it takes a picture of their iris. The iris is actually a better form of identification than the fingerprints, more accurate. So essentially what happens is when we take that picture, it goes right into our computer database, and then if that person were found in New York, for example, wandering the streets, New York could actually bring them in, put them up to there and find out it's Mrs. Jones from Fall River, Mass. She's obviously gotten on a Trailways bus or whatever and gone down to New York. I don't know if Trailways is around here. But anyway, the other thing I was just going to point out here, because I just, on the question of stakeholders, I really think it's important to get educators to these meetings, because they're dealing with families every day, and they pick up the issues going on in families, and it may be a good way to refer people to the resources that they need.
Thank you, Sheriff. Okay, to the next table. Beth, you're going to do a quick report.
Well, after listening to the sheriff, it's interesting that as public safety people here in the city of Fall River, I don't think that we are aware of any of the bracelets or Project Lifesaver. So maybe there's a place that we could start. The other thing we were discussing is that maybe some of the elderly high-rising here in Fall River, they all have management services, getting those people involved so that when EMS goes in, we can identify those people and know whether they've already been diagnosed or if they're having a new onset of altered mental status. That would be really great. The other thing is public transportation, getting public transportation involved so that if we get somebody that's on a bus or it becomes confused, that they can notify the appropriate people. The other thing is making EMS aware when there's a missing person. We're on the street all the time. We see these people, so maybe we would know who the proper person is to take care of. And then, who else do we say? Hospitals. We have no hospital groups here. And those people should be involved in this process. So that's all I have right now.
All right. Thank you, Beth. So some good thoughts from these two tables, from the public safety community and others.
Somebody that's missing is from here is doctor's offices, and understanding if you say we want to teach you about dementia, they know, but as far as the services that are out there and some other things that would be helpful. As they talked about in the stories, retail grocery stores, I think would be helpful so people are aware to be kind and have some patience. And then also restaurants. I think that if a caregiver can take their Alzheimer's or their loved one to a restaurant for a meal for an hour or so and people are kind and patient with them, it would be a great opportunity.
Okay. Okay, great.
One thing, if we're talking about different groups, are faith-based communities, because they would really be at the forefront of recognizing somebody needed help. And pharmacies, because a lot of times they're, the family member will come for education and connections. The Chamber of Commerce and financial institutions.
We discussed a lot about the need for just more education, pamphlets in the community about where to turn when somebody does have dementia. That can be available at many locations. Memory cafes are something that maybe could come into this area a little more. Using housing complexes as a great source of many people in one spot, making them a little more friendly if they're downtown, a little more accessible and walkable. And then getting the business community involved, even in design concepts and how they're designing their own establishments. We did talk about caregiver bracelets with the sheriff's program and what a great benefit that is, but more people need access to them. And the training of first responders, as well as city support.
This was the best table, I just have to tell you. I've heard a lot of good stuff. In terms of strengths, we have a good sense of the community already here in the citizenry of Fall River and the surrounding towns. Lots of good people out there. And there's lots of people and organizations, we are one of them, the Department of Developmental Services, and I'm sitting with others as well, who already have, who deal with people with cognitive limitations in our daily work, and are mindful already of the challenges and the strategies that work for those populations. So I think you've got a good foundation to build on. And we're here in Massachusetts, and where there's already a good and strong statewide network of human services to build on. We could do much worse than to be right here in Massachusetts. Other strengths, we're ready now to move into practical application. This seems like the right place, the right time to be right here, because we know what we need to do to get this into practical use. Gaps, the size of the city. It's a large and complex city by its nature, somewhat confusing for people. The age of the city and the infrastructure can itself cause its own degree of confusion for people who might have cognitive limitations. And the stigma that people have already mentioned within other aspects of the community, in the medical system, in the employment community, and with regards to housing as well. And another gap is identifying those who should know how to help in those places where help may be needed, like the donut shop or the market, places that we've talked about a bit. Priorities for action, develop or identify a universal training curriculum. I get the sense a lot of that work may already have been done, and we just need to appropriate that curriculum, but we need it, and we need it now. Identify those who must know first, not just who should know, but must know more about dementia and Alzheimer's, like police and fire, and like banks, libraries, markets. Working harder to train caregivers and equip them to keep people safe by giving them simple, straightforward, easy to implement guidance. Train the medical community to support caregivers with a good, simple informational process. That means doctors, that means pharmacies. Broader community education. I think someone already mentioned enlisting educators in our midst, both at the university, college and university level and elsewhere, to train people as to how to manage this issue. And then make dementia-friendly status very public and a public relations plus for people. So, something like a sticker on a window of a business that has been determined to be dementia-friendly can build goodwill in their own community and can in fact create something like a gravitational pull so that other businesses then want to go down the same road. That's some way to build a stronger foundation of caring. Key groups or key stakeholders who probably need to be here in greater numbers: police and fire, chambers of commerce, and also the legal community of people to support individuals.
Okay, thank you. Great job. This will be our last group wrapping this up.
Okay, going along with what this gentleman said, we do have a lot of strengths that are there. We just need to bring them forward. We have a lot of adult day for dementia care residents that people just do not know that exist. The gaps is the lack of communication. We need to definitely get that out there for them all. High priority areas is the local churches, the synagogues, anywhere that some adult people and even younger people belong to that we can get to be able to educate them. And also education. We were talking among us here and saying that a lot of times if you decide to have a meeting or something somewhere, a lecture or a seminar or whatever, people just cannot get out to go to. So I think the best thing is to bring us to them. So if we can go to the grocery store and say, okay, when can you guys get enough people together, we will come out and speak to you about dementia care. And then you can bring that back to the rest of the group. And then that way, going along with the sticker, that way then they are already trained, and you will have that sticker to be able to put there, and then everyone hopefully will do better by it. And I think this is a great concept. I really do. I think this should have happened a long time ago. And I think working with the Alzheimer's Association, we tried to pull that forward several times. So hopefully we're going forward. My other big thing is we do not have enough dementia-friendly facilities for them, long-term care facilities. You're going to see now most of them are getting away from dementia-friendly, which is sad because even though they now have to be trained, they at least have to have 8 hours of training every facility, it's still not enough. They need to have a special unit for them. It's very difficult to put someone with dementia in a facility with someone who does not have dementia, because neither one can understand each other and their responsibilities. So I think going forward, I think this is a great thing, and I'm hoping it works out, and I'd love to be a part of it.
Okay, thank you. Well, and thank you, all of you. It was very exciting to walk around and hear all of the great conversations. We've captured much of it here, and as your final act, if you haven't already, please fill in. We want to count you in. This is only the first of a number of conversations that we're going to have, that Bristol Elders will facilitate to make Fall River a more dementia-friendly community. Nancy, did you have any final things that you wanted to say before we send them on their way?
Just, again, I know you've heard it, but we truly mean thank you all for coming and for participating. Do the count-in cards, and don't forget your mugs on the way out.
All right, well, we're actually letting you go a little earlier than planned, so enjoy the rest of your day, and we'll be in touch. Take care.
You are correct.